AG, ACMP nurse practitioners mostly work in a hospital acute care setting. And right now, we're actually functioning as a partner for the intensivist and the critical care physicians. We partner with them, taking care of all the acute care patients and the critically ill patients in the hospital. As we know that the intensivists and critical care physicians, right now we really don't have enough of these physicians at the bedside. So the AG, ACMP fill actually a significant void for these patients that we're able to function as a bedside providers for the acute care critically ill patients. Obviously, as the name AG, ACMP, we're acute care nurse practitioners. Obviously, the acute care part will be very, very beneficial if you have some kind of experience in a hospital setting, taking care of either acute care patients or critically ill patients. That would definitely help you through this program. But it's not necessarily a must, because we do have some students that have some chronic care experience. That's also very, very helpful. Mainly, if you have hospital type of experience, then it will be beneficial to be in this program. One thing that I feel is very important for the students to know is they have to be very, very eager to learn about pathophysiology, to learn about why things happen. Because in critical care, it is so important to know why things happen and how do you intervene. So I don't necessarily think that, it's very important for the students to know how to write long, drawn-out literature and so on and so forth, but they definitely have to have some skills about how to look at a literature and understand what the literature is talking about to provide the best care as evidence to provide the best care for these patients. Interesting enough, I think we are one of the tracks that actually permit the students and afterwards the nurse practitioners to function as a full-fledged provider at the bedside. So simulation, sometimes it's good to give the students an opportunity to actually look at all the critical care procedures, including central lines, arterial lines, and so on and so forth, and to give them an idea of how these lines should be put in and how these lines will benefit the patients. And when they get into a clinical setting, it will be very, very beneficial for them to actually take that knowledge that they have some ideas about these lines and whatever apply to these critically ill patients. We try to have a base for the acute care or the critical care. In our program, we set 3 different settings that will be our core. So we want to expose the students, number one, to a emergency type of care. And we also want to expose the students to patients on the general inpatient. And then we also want the students to have experience exposing to the critically ill patients. Other than that, these are the base for us that the students have to go through within the clinical setting. Otherwise, we also would like the students to have some exposure with nephrology, because majority of the critically ill patients have some kind of kidney problems. And we also would like the students to be exposed to cardiology. Again, it's the same thing that a lot of critically ill patients actually have some cardiac issues as well. and other specialties like endocrine and other subspecialties that we also would like the students to have some exposure to it, because as we know that the acute care or the critically ill patients, we actually look at them as a whole person. We don't focus on one single system on these patients. So we actually want the students to have a lot of these exposures to all kinds of specialty, including the base that we want the students to learn. Because of our relationship with the medical school and even the relationship with the PA school, when we're in a clinical setting, we don't limit our students to only with nurse practitioners. We actually welcome the physician partners who are very willing to teach our students the daily care. Again, we are all providers. We'll become their partners. So we really don't limit ourselves and say our goal is only treat patients based on a nurse practitioner model. We actually work very, very closely with the physicians. We also work very, very closely with our partner, the physician assistants, because they also provide the same type of care for the patients. So we collaborate with all these other disciplines to have such a broad view of how everybody will contribute to this patient's care. We do not have a final project for the AG-ACMP students. They go through the clinical the last 2 semesters of their program, and they do have seminars that they have to prepare, and they work with their classmates to come up with little lectures that they have to prepare and present to their classmates. The program is a hybrid program. We have online modules that the students have to go through on their own, and they have quizzes based on their reading. And we also have face-to-face lectures the first 2 semesters, and the last 2 semesters we actually have a face-to-face seminar that the students participate, and they actually have to come up with projects and they have to have presentations to their classmates. Overall, that the need for acute care nurse practitioner has grown tremendously in the past few years because of the hospital-based practice, and there are just more and more inpatients in the hospital. Because we are highly sought after by a lot of specialties, especially in hospital specialties, and all these specialties are looking for acute care nurse practitioners to fill the void of not having enough intensivists or critical care medicine physicians. So if I have a student that performed very well with certain specialty in the hospital, that specialty tends to recruit my student right there without having to interview for the position. So in that sense, I have many students actually receive an offer before they even graduate from the program.